want to talk today about the face covering order and recommendations that we've made in conjunction with the CDC. It's important to understand that these face coverings are really designed to help protect other people from the person wearing that face covering. This is not designed to protect you from people who are sick. This is not a healthcare grade, because we don't expect members of the public to be caring for those who are sick. We really must reserve those surgical masks and those N95s for our healthcare workers and our first responders, so that they can protect themselves and they can work closely on patients who need their care. And it's also important to understand that this has to be used combined with social distancing. This is not a substitute. This shouldn't give you any sense of comfort that you can move closer than 6 feet between people. So in combination, this can be an effective way to help further flatten the curve and prevent the spread.
All right, Dr. Escott, my name is Luis De Leon. I'm a reporter with KVUE News here in Austin. Thank you so much for taking the time this afternoon. And so I'm going to start with one question from each outlet going down the first column, and then I'll go to second questions from each media outlet. We're going to start with us here at KVUE. Will this recommendation will this become mandatory? Will there be a recommendation to make these masks mandatory for citizens here?
We're going to continue to review that and take into consideration the spread of disease here in Austin and Travis County in Central Texas. My expectation is that at some stage we will transition this from a recommendation to a requirement. And we are particularly thinking about that as an effort to try to open businesses and get people back to work as soon as possible. If we can really help mitigate the spread further, it may allow us to open businesses again sooner.
This next question is from the Austin American-Statesman. Since the city has stepped up recommendations related to masks and personal protection, are there any plans to increase enforcement to stay-home orders for individuals and businesses? And at what point would the city start taking enforcement action?
Well, again, I think we're really asking right now for voluntary commitment to really helping stop the spread of disease. When people are making independent choices not to follow the recommendations, if they're making the choices to gather when we're saying not to, that's going to cause more people to get sick. It's going to cause us to have further delays in getting businesses back open. If we can continue to see evidence of that, we're going to have to take additional action to ensure that we can control this, we can get people back to work and get our economy going again.
This next question is from the Austin Chronicle. In regards to the mask, does it matter what kind of fabric people are using for face covering? Are there better or worse choices for these homemade masks?
So cotton is the preferred. As long as the thread count is high, the higher the thread count, the better the filtration is going to be. I've got a couple of examples here. This is a commercially made cloth mask that fits over the ears, which can be used and can be fashioned at home. Another example that can be used is a scarf like this. The key points are that it needs to cover the mouth and the nose, and it needs to be comfortable for the wearer. What we don't want to happen is for people to wear things which are not comfortable, and they end up adjusting it, touching their face more often than they normally would, because that will defeat the purpose. So, people need to try different things for themselves, see what fits well. I have issues with fogging my glasses that a simple piece of tape across the bridge of the nose helps to alleviate. So we want to give people an opportunity to try different things, see what works for them, and understand that the public masking may need to happen for an extended period of time. So, create more than one mask or one facial covering so that you can have some, you can cycle them, so you can wash them and wear a new one every day.
This next question comes from KXAN. It says, what is being done to help low-income people who don't have masks and can't afford materials to make them? Will the city be providing any other resources to them?
We're talking to our business community about the availability and the ability to transition some of their operations to create masks or other facial coverings. Really, everyone has the materials at home. There are instructions online, both from the CDC and our Austin website, on how to make them at home, from things like t-shirts. And folks can look at that. If they have a sewing machine, there's instructions on how to sew them. If they don't have a sewing machine, there's instructions on how to cut material like t-shirts to create their own facial coverings and masks.
This next question is from Community Impact. In the past, we've heard that face masks aren't necessarily effective in stemming the transmission of COVID-19. So can you speak to why the CDC and APH's stance on encouraging the use of masks has shifted?
That's a great question. So our discussion all along has been about the intention of wearing the mask to prevent the wearer of the mask from getting exposure. That's not what these are for. These masks are to prevent other people from being exposed from the wearer. And why that's important now is that we have increasing evidence that those without symptoms, as well as those who have very mild symptoms that may not even realize they could be infected, have the ability to transmit the disease. So by asking everyone in the community to wear these masks, it's protecting others from the person wearing the mask or the face covering.
This next question comes from Fox 7. Numbers of new cases tended to not be as high of an increase over Friday, Saturday, and Sunday. Is social distancing and mask wearing working in slowing the spread here?
Well, it's still a little bit early to tell. Usually we want to give it a 14-day sort of break-in period for policy change. So that happened, our stay-home order happened on the 25th of March. So we really expect to see the full effect of that starting this Wednesday. And we're anxiously paying attention to the data that we get every day, particularly this week and next week, to see if that social distancing is really working.
We're going to move on to the second set of questions now from the media outlets. We'll start right back up here with KView. So from KView, where are people catching coronavirus the most? Is that able to be determined right now? Like, is there, are the cases being like traced continuously?
It's a continual process of contact tracing. Cases early on seem to be really related to travel. Some were related to social gatherings and conference attendance. Now they seem to be more related to community spread, where we may not have a clear indication of where it came from, and also transmission amongst family members. This is why we're really trying to encourage folks, if they're have a confirmed case of COVID-19, that they stay in a hotel that we've organized to really separate them from their family, so that they can decrease the risk of spread to their family members, and they can recover in a comfortable setting.
All right, this next question is from the Austin American Statesman. How long can COVID-19 survive on cotton? Should people be concerned about their clothing, shoes, masks that aren't well laundered, I believe is the word being used?
So for the general public, the risk of getting COVID-19 on them is going to be extremely low, particularly if they're practicing social distancing. We've talked before about the travel of droplets. It really doesn't go 6 feet. So if they're maintaining that social distancing, there should be little concern about getting it on their clothes. Again, this reinforces the importance, even when they're at home or when they're out, that they wash their hands frequently. They avoid touching their face. Even if you get it on your clothes or on your hands, if you're washing your hands frequently, using hand sanitizer, and avoid touching your face, you're not going to get it.
A couple of questions left.
This next question is from the Austin Chronicle. Should people wear face coverings while driving and when doing curbside pickups of food, supplies, etc.?
So they don't need to wear the face coverings when they're driving by themselves in a car. If they're going to a drive-through, for instance, if they're going to curbside pickup and there is going to be or anticipated face-to-face interaction, they should have the face covering on then.
Real quick, I'm sorry. I thought I heard someone in the background say something, and I didn't hear them the first time, if they were trying to say something.
They were trying to say 2 questions left.
Okay, got you. Okay, I just wanted to be sure I correctly heard that. Okay, so the next one that I see down the line here is from Community Impact. Can we expect to see masks in use by public officials in the city and county?
You know, the elected officials, other officials have been involved in this discussion, in this process. I would expect that they will wear them when they're interacting with other people. In situations like this, where everybody's far away from me, and people rely on being able to read my lips to understand what's going on, we're going to take our masks off. As soon as I stand up from here, my mask goes back on. Again, it's important for all of us, including governmental officials, to be a part of this solution. And my expectation would be that they would heed that warning and comply as much as possible.
From what I can see and from the number that I've counted now, I believe that is all the questions that we have. Dr. Escott, do you have any final remarks or a statement that you'd like to add?
Again, it's critically important that folks understand that they don't need to rush out and get surgical masks. They don't need to rush out and get N95s. If they have those at home, we're really asking them to donate those to the Austin Disaster Relief Network so that we can get those to the frontline folks, our first responders, our healthcare workers who desperately need those to stay safe. We need our healthcare workers and first responders to stay safe so they can take care of the rest of us. Again, the cloth masks are fine for what we're intending them for, and that is to protect other people from the person wearing the mask or the face covering. It's also critical to remember that this is not a substitute for social distancing. It has to be done together. And we have evidence from the 1918 pandemic that when those two messages didn't happen together, that the effect was that the cloth mask gave a false sense of security, and people congregated, they came within 6 feet, and it increased the spread of the disease.
All right, I think that should be it. Thank you so much, Doctor. Appreciate it.
You bet. Thank you so much.
Will Dupree once again here in the KXAN live studio. You just heard a video conference call wrap up with Dr. Mark Escott. He is the interim health authority for Austin Travis County, and he was talking particularly about the new requirement that the CDC has issued and that the city of Austin and Travis County are wanting people to follow, and that's that if you're going into public, for people to wear cloth face masks. That is a new thing that has come out, and I want to show you all. These are the new recommendations from the Centers for Disease Control and Prevention. There in the middle of the list, you can see that people are being asked now to cover their mouth and nose with a cloth face cover when around other people. And the doctor was saying just a moment ago that cotton is preferred. The higher the thread count, that helps with filtration, and it needs to be able to cover your mouth and nose, and it must be comfortable because you'll be wearing that presumably around if you're going to do essential things like to go to the grocery store or to pick up takeout or to go get gas in your car. Those are the when you need to wear this mask. He did say, and I want to reiterate this too, is that these masks are being asked to people are being asked to wear them because they are to prevent others from being exposed to the wearer. COVID-19 has unfortunately been known to show no symptoms in people, so some people have no idea that they have COVID-19. They're not showing anything that would tell them that they have it, so they're asking you to please put on this mask because of that asymptomatic status of this particular virus. This is a way that you can help protect yourself from others, and others can protect you. This is all about a group mentality, so something to definitely consider. And the doctor had mentioned a minute ago too that people are wondering where they can get these masks, and you need to look no further than what's in your own home. You can make these cloth masks right there. The supplies are all handy, hopefully for most of you. So earlier today, our morning traffic anchor and our noon anchor, Amanda Dugan, she posted a video on social media talking about how easily and how quickly you can make one of these masks. And I want you all to watch this video, and hopefully you can pick up some pointers and do this at your house too. So please take a look. Again, this is Amanda Dugan making an at-home face covering to help all of us protect ourselves from the spread of COVID-19.
Hey everybody, so as you know, there is an order now to make sure you have a mask on your face if you're headed outside into public. So I know there's an issue with getting masks, and many of you have been asking where you can get them in stores, but there's a really easy solution here, a no-sew mask. If you have a bandana at home, all you gotta do, fold it in half, Fold it 2 more times up, flip it over. 2 hair ties, ponytails, whatever you like to call them. Onto one side, onto the other, pull it through. This super easy part, fold it in. And just like that. Ta-da!
So simple, so fast to make, and we all can do that. I know that in my certain situation, I've used a scarf and kind of doubled it over and then wrapped it around my head as I've gone in and out of the work of the station here, just to be able to protect myself and potentially benefit somebody else's health as well. So once again, if you want to take a look, these are the guidelines that the Centers for Disease Control and Prevention are saying at this point, and Austin and Travis County are reiterating it too. Number 1, clean your hands often. Number 2, avoid close contact with other people. Number 3, and this is what they were just talking about during that video conference call, cover your mouth and nose with a cloth face cover. And then 4 and 5 there, cover coughs and sneezes. That's something you should do all the time. And then clean and disinfect any surface that you might touch throughout the day, just to be safe and secure in your own home and around your own workplace and wherever you might go here, even though there is this stay-at-home order issued for this particular area. We do have updated numbers as well regarding the number of positive COVID-19 cases. The numbers have been flooding into our newsroom here within the last 30 minutes or so. So I wanted to show you all, we're trying to keep track of our most populous counties. That's the ones you see right here, Travis, Williamson, and Hayes counties. Now you see Travis County stands at 484 cases, 6 deaths at this point. Williamson, 81 cases, and they reported another death this morning. So that brings it up to 3 from COVID-19 here. And then finally, 54 cases in Hayes County. Across our entire viewing area, I want you to see this. We've gotten some new numbers here just in the last few minutes. Bastrop there is now reporting its first death from COVID-19. We also had another few cases named in Gillespie, Fayette, Lampasas, and Milam counties. We're keeping track of these numbers on our website as well if you want to see a more in-depth look at it, kxan.com and the KXAN News app. Right now, I'm going to end our stream, so we do appreciate you all tuning in for another update from another live source. We thank you for trusting us here at KXAN to be able to share this information with you as quickly and accurately as possible. It is a big task for us, but we want to do it for you all at home so that you feel safe, feel informed, and feel secure. Once again, I'm Will Dupree here in the KXAN live studio. Please stay at home if you can and be safe and healthy. We'll see you back here another time.